Hello. Hello, hello. It's kind of like,
Angle
see the
down
angle,
portion.
yeah. I mean, it's not horrible. I mean, it's fine. It ain't a big deal. That's a little better, yeah. But this thing makes my phone beep. Yeah, there you go. That's good. Hi, y'all. I'm back. Okay, hi, Instagram, Facebook, YouTube. Hello, hello. So, y'all can see from the title that I want to talk quickly about awake liposuction. So I opened up my practice. Well, actually, I got the space. It'll be 7 years ago next month that I signed the lease for Ederra Bella Plastic Surgery and Medical Spa physical location. Okay, and then we spent a few months building out. And so I opened in January of 2016. And the first thing that I did was liposuction in this office, in this room. Liposuction was really how I grew my practice. It was even though I did other things, it was what I talked about the most other than skin. And awake liposuction was what I did the most. I would only go over to the hospital if I was combining it with other procedures, or if a person was getting a tummy tuck, or breast surgery or face surgery. But liposuction, for the most part, I did in my office. And then once the pandemic hit, it was a lot of roadblocks to me doing that. Staffing, supplies, getting the supplies, all that kind of stuff. And I stopped doing it. Well, now I'm about to start back up. So I've done a few here and there, small little like chins and stuff like that. But I want to get back to my roots, for lack of a better term, and start to use my office in its fullness. I never really got back in the stride that I was in before the pandemic hit. And so, now we're going to start doing what we're known for. So, I was doing awake liposuction on people before a lot of others. It's other plastic surgeons now that are doing it. Before, it used to be really just folks who weren't really plastic surgeons doing it. But there's a few plastic surgeons who have, been doing it and getting beautiful results like I did. And so now I'm going to offer that. I'm going to begin to offer that to my clients once again. Mostly it'll be like lipo to abdomen flanks, or if you just need the back. I'm not going to be doing 360 in the office setting. I'll likely continue to do that at the surgery center. But if you're getting like your abdomen and flanks, or you just need your back or your thighs or your arms, chin, that I will do here. I'm really, like I said, that's how I started. That's how I did it the most before. So it's like, that's my jam. That's what I do. So here's the room. This is the room that I literally, when I built this place out, I'll let you enter from the angle that you would enter from. You're going to see a little setup back there, but hold on, let me show you the room. Okay, this is the room. Nice little spacious room. See? Being yourself is the prettiest thing you can be. Yes. So this is the machine. It's a big room. Got a TV up there so people can chill. But this is a space. So how it works when you come into the office for liposuction, if you will come in the morning, probably about 8:00. You don't have to be there at 5 a.m. You actually don't have to be NPO, meaning NPO stands for nothing per aura, meaning you don't eat anything by mouth. You don't have to do that because you're awake. So you're not going to be going under general anesthesia. How it works is you would take some pain medicine and like a Valium to just help relax you. You're wide awake. You can talk, you can walk, all that stuff, but it just calms you. And then I numb you with a solution called tumescent solution. It's a combination of salt water, which is normal saline. Lidocaine is in there, which helps numb you. And then epinephrine, which is something your body naturally makes, but it helps make your blood vessels constrict. And so that helps keep you from losing a lot of blood. I allow that. I infiltrate that into the area that we're going to work. And then, so I usually will let that in the office setting, like in the OR, I let the tumescent sit for like 5 minutes. But when I do it in the office, I let the tumescent solution sit for like 30 minutes. So that's when people are watching TV. Like, cause it's like, once I get the solution in there, we have to let it kind of seep into all the tissues so that everything gets nice and numb. And then once that happens, I'll come and I'll start liposuctioning. So the liposuction, this is a liposuction cannula. And this is hooked up to that machine, which has a vacuum. So there's a tube that goes to that machine that I just showed you, this machine. See it over there? There's a tube that goes from here to there. And these little holes is where the fat goes through and comes through the straw to that machine. So this is a lipo cannula. So I do that until things look like we want it to look. And then we're done. So now that fluid that I put in you, the tumescent solution, my team will push some of that fluid out and we put you in your garment and package you up so that you don't leak on your car going home. Because I leave those holes open so all that fluid like gets squeezed out over the course of the next 24 hours. And then you'll probably come back the very next day for an appointment with us and get your first official lymphatic massage and start healing. So that's how that process goes. Usually for liposuction of your abdomen flanks, you would get here probably about 8 a.m, and you would be here with us till sometime around noon. You would just plan on half of a day here. How do you determine if a person can do awake lipo versus other lipo? Most people are fine for awake lipo. I literally, when I first opened, I did like 95% of my liposuctions in the office. And I was even doing 360s in the office. It was maybe once or twice where we stopped, and because the person was just way too just anxious and everything else, and we ended up doing her in the OR instead. But I've done, I don't even, like, so many cases, like thousands, and most people handle it just fine. The few people who have had issue are people who are anxious. And once your mind starts running, it's like impossible to calm that down. So I can usually tell now, I can tell in the consult most of the time if a person's going to be, their anxiety or whatever will be an issue, like the type of personality they have, I can tell. But most people do just fine with it. It's really, usually it's like the fear of the unknown. And then once they see like, oh, that's it, they're fine. Or then people will be like, oh, I want to get my such and such. They'll start ordering up more stuff once they see it's not that bad. It's really literally I used to, when people like, I just really want to be put to sleep, I would convince them to get it awake a lot of times. So if you are interested in awake liposuction, give my office a call. The number to my office is 678-325-0006, or you can put in a consultation request. I'm going to pin it. Or you can click the link in my bio also, and that'll allow you to put the information in for a consultation request. So now for awake liposuction, we have openings as early as mid-September, but not for the OR. Like any surgeries that you like, if you need a tummy tuck, if you need breasts, we don't have any openings for that in September. But for awake liposuction, I've carved space out in my schedule for awake liposuction. Can I get mine from OR to office? It depends on what you're getting. If you're getting lipo 360, we got to do that in the OR. Call and talk to Tiara. Did the patient get here yet? Okay. I don't do fat transfers even in the OR anymore. Like, I don't do fat transfer. I don't do fat transfer. If you want fat transferred, I'm not the person. But I do gluteal contouring. So depending on what you're starting with, gluteal contouring is pretty. Let me see if I can find a quick gluteal contouring one for you. Well, this is not even a gluteal contouring, and I didn't even do her back, and you can still see her butt looks better. Hold on, let me show you something. Wait a minute, that's probably not the right view. This is a liposuction. This is a liposuction of the abdomen and flanks. Hold on. Look at her. Look at her butt. Nothing was put in her butt, but you see her butt looks rounder and bigger when her back well, actually it was her flanks that I scooped out. But let me find you one. Let me find one that has, I did a video with abdomen flanks not too long ago. Let me see if it's still in my camera. I mean, of gluteal contouring. I take a lot of pictures in this phone. Nope, that's not it. Hold on. Hold on, y'all. Dang, it made me start all the way over.
Can you show video?
Yep. You have one?
Well, you want abdomen flanks.
Well, no, I want to show a gluteal contouring. Let me see that one.
The video.
Press play so I can see what it. But she started off with a big butt. I had a good one. Hold on. I had a good one of someone who... Here it is. This is a gluteal contouring person. You see her butt in the before picture seems like it's kind of flat, and in the after picture it looks round. All I did was liposuction. I didn't add any fat to her butt. Yes, gluteal contouring can be done in the office but not, okay, yeah, just get a consult. You need to get a consult. It's just liposuction. Gluteal contouring is liposuction. It's taking away fat from the right area so that your butt shows up. And you can sit the same day and there's no risk of fat embolism that kills people. Skin removal with tummy tuck revision and breast lift needs to be done in the OR, but yes, I do that. So I don't do fat transfer. Not to the butt. I'll transfer fat somewhere else, possibly. Not breast or butt, I won't transfer fat. And I can do a video about that and why I don't. But I don't want to make this about that. This video is about the fact that we are now offering awake liposuction once again at Ederra Bella Plastic Surgery and Medical Spa. I would do your abdomen and flanks. I can do your arms. I can do your thighs. You can't get all those areas done at the same time in the office. But, I'll do pretty much anywhere. I'll do your back if we're not doing your belly. Sometimes people just get their backs done. So I'll do one area, one main area. But I'm not going to do 4 or 5 areas in the office setting. If you need a bunch of areas, then we'll do that in the operating room at the surgery center. The cost ends up being less for awake liposuction because you don't have to pay an anesthesiologist. You're awake. So it does help the cost a little bit. Yeah. So if you're interested in learning more, if you put a consultation request in, say awake lipo, and you can, I guess maybe we can offer a consult special for awake lipo for until what,
September.
We'll offer a consult special for awake liposuction through next week. So if you want to get a consult to see if you're a good candidate for it, then I'll have a reduced consult cost just for that. So if you click the link in my bio to set up a consultation request, put awake lipo in there so they know to give you the consult special. I have patients from overseas. I do have patients from overseas. I've done people from the UK, from Afghanistan, Dubai. I've had patients from Canada. That's not overseas, but it's out of the country. Yeah, I have patients from all over. Most of my patients are from the United States, but most of my patients are actually also from outside of Georgia. They come here. So, all right, y'all, my patient came, so I gotta run. So if y'all interested in getting some liposuction, awake, I'm your girl. All right, I'm Dr. Myla Bennett of Ederra Bella Plastic Surgery, Myla Bennett Powell of Ederra Bella Plastic Surgery and Medical Spa in Johns Creek, Georgia. Give my office a call, 678-325-0006, or you can click the link in my bio and set up your consultation. And I will say awake liposuction in order to get the consult special. And I look forward to seeing you guys. All right, I will check y'all later. Bye.